to die, it's worth it to hear the story of Yehuda, how it happened from beginning to end. It was one long ness. It was one long miracle. It started 5-6 weeks ago. He started having a very strong cough. He was coughing blood. We went to Dr. Gobari and he prescribed cough medicine, and it didn't help. And Dr. Gobari told us to go get an x-ray. Yehuda thought he would get over it, so pushed it off a little bit. So finally I convinced him, let's go to Dr. Zakaria at his office right here. Went to the office, did some testing, he did an echocardiogram. They didn't see much. Didn't see anything really. They gave him antibiotics. They thought maybe it was an infection, maybe it was pneumonia. Weren't sure what it was. So push came to shove. Last week, Shabbos, he came to shul. The doctors saw him that he deteriorated. He lost 30 pounds. Very concerned. And they said he has to go to the ER because we went to the primary care and they put in for the insurance to approve more testing. In fact, just yesterday we got the letter of approval from the insurance to do more testing. So it didn't work. They said you have to go to the ER and you get all the tests possible. So he said, I promised I'm going to work tomorrow. This is Motzei Shabbos. He said, I promised I'm going to work tomorrow. So he says, after work. So sometime mid-afternoon on Sunday, he texts me, he said, let's go at 8 o'clock. I told him that I have Seder, so let's go at 10 o'clock. I forgot I didn't daven Ma'ariv, so I stayed for Arvit. I don't look at my phone, but I got a missed call at 10:06 from him. I was late. 10:14. I was talking to him on the phone. I was by Lindley and Ventura, 2 blocks from here. And I told him, come outside. I'll be outside in 30 seconds. We'll go. Don't bring anything you need. We might be there for a day or two. Bring whatever you think we need. And I come outside, and he's not coming outside. I call him up. He doesn't answer the phone call. Got a little nervous. My father came outside. He told me to come in. My heart started pounding. He already passed out. Passed out on the floor. Revived him. We gave him some oatmeal and sugar. He couldn't even carry it to the car. I had to carry it for him, the rest of the oatmeal. And we went to the ER, went to the hospital. We get to the hospital, they take all the blood tests, they EKG, all the normal things they do. The ER doctor, Dr. Kopp, if I pronounced it correctly, she assumed there was some type of infection on the heart. She didn't see a reason to do a CT scan, CAT scan. But she ordered an ultrasound. And in the meantime, we called Dr. Zakaria. We told him we're here and hook us up. So he called her up. He's also part of Providence Tarzan Hospital, so he told her to admit him. So she okayed it. She said admit him. Finally, they gave us a room 112. The transport came. And as we're leaving the ER, I see the ultrasound guy coming. I told the transport guy, I said, listen, let's go back to the ER, let him do the ultrasound, because if we wait, it might take a couple hours till he comes around to the room. And he says, don't worry, I'll tell him we're there, he'll come. I didn't put up a fight, which is not like me. And he told the ultrasound guy, he said, we're going to room 112. He says, I'll come straight there. He had other patients in the ER that he had to do, but he said, I'll come straight there. And he came straight there, and they designated a doctor, Dr. Tabibian, also a Persian Jew. And they did this ultrasound right in front of him. And they saw that his heart was 3 times the size. I mean, if they would have done this in the ER, it would have taken a couple hours till the test results came in even. It was Mir Shemayim that it happened in the room where the doctor was overseeing him, and he saw it. And right away, he ordered an emergency CAT scan. And I remember him telling the CAT scan person, he said, I want the results right away, nothing in between. And as he suspected, there was a blood clot. They thought it was a blood clot at that point in the pulmonary arteries, an artery between the lungs and the heart. It was so big there was no way for oxygen or blood to go in between, which in medical terms it's a miracle that he's even alive. This was about 3:30 a.m., 4 a.m. that we got. That they transferred us to CV ICU, cardiovascular ICU. They brought on the case. They brought the pulmonologist on the case. They brought a cardiologist on the case. They brought a thoracic surgeon, oncologist, hematologist. They brought all the top doctors there. I should also mention that Dr. Hakimi is just part of St. John's Hospital in Burbank, but it's also Providence. He was able to see all the CAT scans. He himself is a pulmonologist, and he saw the results, and he showed it to his oncologist, his cardiologist, his thoracic surgeon. They were all watching everything being done. They were being watched from 2 places, make sure the right decisions. He even called the pulmonologist, Dr. Kakal, the pulmonologist here in Tarzana, and they talked about certain things to come to certain decisions. And so they assumed there was a blood clot. They wanted to give him what's called TPA, which is a risky medicine to take away blood clots. It's a type of blood thinner, but it can cause bleeding even in the head. So they had to take another CAT scan of his head to make sure there was no prior bleeding. And then they administered the TPA about 2 o'clock, 1:30. Wherever they took needles from got bloody. That's what this medicine does. He was bleeding from those incisions. It didn't work. Usually you see results in 1-2 hours, but they said open on blood thinners for 24 hours. So it was already Tuesday morning. He started looking better. He was on IV. He was looking better. He was feeling better. They even said that they might take him out of the ICU by Wednesday. Right away I called Dr. Zakaria. I said they want to take him out. He says, don't worry, I got your back. I said, he's not going nowhere. I'll make sure of it. Came Wednesday morning, and his heart rate was about at 120 till then. His heart rate went up to 150, 160. The normal heart rate of a person is about 70. If somebody exercises for an hour, maybe 130. But he was 150, 160. He even hit 171. If somebody hits 180, he can't survive. The heart can't survive. By Wednesday morning, he told me something very interesting. He said that somebody next door was playing music every hour, and they were playing the tune of a Shem Avoisai, which is Hamalach HaGoyal. It turns out it wasn't next door, but every time somebody's born in a hospital, they play music to congratulate. So he was hearing that music, but he heard the tune of Hamalach HaGoyal. And that was a turning point for him where he really deteriorated. I don't know what that means. So Wednesday, At 1 o'clock, I spoke with the pulmonologist, and he put his head down, and he shook his head, and he says, we have to do a biopsy. They refrained from doing a biopsy because he was too risky. His heart and the blood clot were the immediate danger. Even if there was a tumor of some sort, it's not immediate danger. The blood clot was immediate danger because he couldn't survive like this. But then he said, we have to see what it is, because the blood thinners weren't working. And if his lungs collapsed, his heart would not be able to take any more pressure. So it was extremely risky to do a biopsy to see what it was. And he says we're going to do it tomorrow morning, Thursday morning. I asked him, he's probably one of the more honest doctors, to be honest. I asked him, should we go to an academic hospital? Cedars, UCLA, something academic. He agreed. He says yes. He's like, we're doing our best. He said he spoke with his surgeons and his teachers from USC. They didn't know what to do in this situation, but they recommended do the biopsy. So that's what we recommended, but he was totally fine and pro if we wanted to go to a bigger and better hospital. So I called Dr. Hakimi and I said, we got to get out of here. He said it's not just about a bigger name, not just about a better name, better hospital. You have to have a surgeon that knows what to do and will accept the case. Without the surgeon, this is useless. He says you also have to make sure that they'll accept him, transport is okay, and they accept his insurance. So we started working the phones. We somehow, which is a nace, to get in touch with surgeons is not so pashut. It's not so easy. We got in touch with Children's Hospital. They didn't want to take this. They didn't know what to do. We spoke to several surgeons at Cedars. None of them knew what to do. We spoke with City of Hope. They didn't know what to do. We got in touch with UC San Diego. They are probably the biggest experts in the pulmonary arteries. And they also were very hesitant. They asked Tarzan to do an MRI. And Tarzan refused because they were scared to move him from one building to the next building. That's how delicate he was. They were scared something would happen. They didn't want to do an MRI. So UC San Diego, we're probably in touch with them about 4:30. We finally were able to WhatsApp the video to him with a CT scan. I even mailed them a copy of it. Got there before 8 a.m. Got there at 7:13 a.m. And they were skeptical, and the surgeon said he wants to talk to his team. And he talked to them in the morning. Yaakov's father-in-law, Zohar, he had a business relationship with Dr. Steve Schwartz, the head of the Eye Institute of UCLA. And at 5:30, we three-wayed him in, and he told us, if you want to come to UCLA, he's in. Anybody knows about transfers, it takes 3 days minimum, if not longer. It's a process. And Yaakov said, listen, can we give you the number of Dr. Hakimi? He's helping us on the case. You know, we can't have too many. Everyone has their own day. Everyone has their own opinion. We couldn't have too many opinions. And he screamed at Yaakov and he said, yes or no, it's your brother's life. It's not a game. So Yaakov said, give us a few minutes. Call Dr. Hakimi. Simultaneously, he was working on UCLA. There was a surgeon, Dr. Shimon. The accepting doctor was Sam Waite, Dr. Sam Waite. He found that happens to be Shimon was out of town for the week on a family emergency, and he got through to Dr. Moriarty, his backup, and he said he was good. So simultaneously we got a hookup inside UCLA. We found a surgeon also at the same time, which was Min HaShamayim. And we set in. So right away, we started the process of getting all the paperwork, all the films to UCLA. And Dr. Zakayai had him talk to the doctor at UCLA, and he told them that he's okay for transfer. Remember, they didn't want to move him to the next building even. They say he's okay for transfer, and they accepted, and they even accepted him without insurance, because they didn't accept his Medi-Cal HMO, Valley Presbyterian. They only accepted LA Care. They accepted him. That was at 7:30, 2 hours, the whole process. So the case manager came and said, I don't know how this happened. They were in the spell. They were amazed. For me, I didn't really understand how quick that was until afterwards, when you see everyone amazed at what's going on. And she says he's accepted, but they don't have a bed in the pediatric ICU. So we have to wait till the morning till they can clear a bed for him. So Dr. Steve Schwartz set us up with the VIP, I don't know, his secretary or some line by Joanna. She was the one helping me through the process. I was even able to text. It was direct line. I picked up, every time I called, she picked up first ring. I told her, listen, let's send him to the adult ICU, and then in the morning we'll transfer him to the pediatric ICU. I was nervous. I want him to go to a better hospital right away. Every second counted. She says, they already said no. I doubt it. I said, you're helping us, please just try. She said, okay, I'll try. I called Joanna and I told her, can we please do this? Can we please send him to the adult ICU and then the pediatric ICU? She was very reluctant. I said, I know you're helping us. It means a lot to us. Just try this. She agreed. She called me back a minute and a half later, and she said, there is a bed, but they don't want to take him because they want all 20 doctors on site when he comes, in case something happens in transport. Like, the case manager came back and said, they said no, there's no bed. So I informed her of the real reason that they wanted all doctors there. They showed up in the morning. His heart rate actually went down at night. That Wednesday night went down to about 120, 125 middle of the night. They showed up in the morning with like 6 doctors with a helicopter. There was no helipad at Tarzana, so they had to go to Van Nuys. They went to Van Nuys, and there was no transport from Van Nuys to here, so they had to move it to Burbank, the helicopter. So it got a little bit delayed. But I mean, to arrange a transfer this quickly, even if you get approved, also can take time till they put you in the roster to get picked up. They brought life support, and when they came and they saw Yehuda, he was coherent and able to talk. They asked, is this the patient? They were shocked. From his symptoms, from the record, it didn't make sense that he was able to be coherent and talk. And by the time they took him, it was about 10:53. We left the hospital. They decided to drive him. There was less traffic then, and to put him up in the air with oxygen issues, it was better to just take him, to drive him. When we got downstairs, they told us he's in room 5419. So we go up there. When we get there, there's nobody in the room. And right away, a nurse comes up to us and they said, are you for the 18-year-old boy? Said we moved him to 33, 5433, which was a room that can turn into a surgery room on the spot. It was a VIP room. They did some more testing, and for some inexplicable reason, they did not do the biopsy on Thursday. I don't know why. I still don't know why. Dr. Zakaria came around 11:30 that night, Thursday night. And he came, he saw his heart rate 154. Spoke with some of the doctors. They were scared to give him any anti-anxiety, any type of medicine that might shut down his system. And he came and he told me, it's not me, it's not the doctors. It's Yehuda and Hashem. They were nervous that he wouldn't make it till the morning. I was so distraught. Like, why didn't they do it already? I went to sleep closer to 1. Yaakov was in the room. There was only one bed. Yaakov took the chair. That's what happens when you're older. I woke up 5:27. I jumped out of bed. I looked at his heart rate. He was at 115. Didn't make sense. I kicked Yaakov out of his chair. I told him go to sleep. I davened. I missed nets by a few minutes. I remember I got on the phone to Tzvi. I talked to him the night before. I emailed him, asked him about questions. I came back into the room about 7:45. Yehuda was up, and he told me tefillin. Every day he told me tefillin. He couldn't move his hands, as his delicacy was couldn't move. His right hand had a PICC line in it. His left hand had the blood pressure, but he couldn't move. Anytime his blood pressure would fall down, he would have us pick it up. He couldn't move. When it came to tefillin, he would lift up his hand. He got strength from somewhere, from I don't know where, and he put on tefillin. He said Shema. Nurses were trying to come and do stuff. He would stop them, and they told us they were moving up the biopsy from 12 o'clock to as soon as possible. I called my father to come. He said, I'm not coming till after Daf Yomi. And Baruch Hashem, my father came in at 9 o'clock. And the biopsy was about 9:30. We were going downstairs, transport came. We're going downstairs. Yaakov told them, stay strong. We love you. Called my father, kissed him on the head, told him we love you. I told him that it's a minhag before one goes to sleep to be mochel everyone, and that should be a zechut. Little did I know that was the last time he was going to go to sleep. And he looked at me in the eye, and he nodded, and he was mochel everyone. That was the last thing he did. Part of the siyata d'shmaya of not doing the biopsy on Thursday was Tarzana did not want to do anesthesia, because anesthesia would, in essence, shut down the system a little bit, and they weren't sure if it would restart. UCLA also had the same thought on Thursday, but Friday morning, the radiologist came in, anesthesiologist came in and said we're going to do it. They had life support on hand. They had all 20 doctors in the room with him. They told us we'll be out in an hour. And an hour and a half, they came back. Well, the truth is, we heard a code red on the system, on the loudspeaker system. And I ran to ask a doctor. They said it's not you guys. A few minutes later, we heard code blue, which means his heart stopped. And they tried resuscitating him. And they came and told us that everything they tried didn't work. But he was asleep. He went in peace. A few minutes later, they got the results. It was angiosarcoma. The detection rate for such a cancer is 0.001%. And even if you do catch it, it's 4 or 5 months of Gehenna, and that's it. There's no cure. Looking back, it's been a Shemayim, he barely suffered from it, just a cough, nothing else. When we heard the news, 11:15, I turned to my father and said, "When do you want the Gvura?" Without flinching, he said, "Today." Right away I started working the phones, called Chevra Kadisha, and they told me it's impossible. Gave me some paperwork to fill out, the prices. They didn't, it's not going to happen today. Right away I called Akiva Nerola. His father-in-law is Menashe Ayem, he's part of Chevra Kadisha, and I told them, I need this today. He called his father-in-law, and he told me you have to do something about it. He called Home of Peace. He called Frankie and Richard. Richard's the owner, Frankie is running the show there. On the same phone call, he said, "Come pick a spot at 3 o'clock. But he said, you have to get me the paperwork. You have to get me the paperwork. The coroner's office needs to approve this. Anybody that's dealt with the coroner's office knows they'll pick up even a 100-year-old person and hold them for a few days for no reason, just to double check everything." Somehow with one phone call from the doctor, coroner's office let it go. All the paperwork was done. We sent Rabbi Gigi and Rabbi Zadmer to Home of Peace to pick a spot. And they wanted to give a spot in the middle, but we're Kohanim, we wanted a spot on the side. Chevra Kadisha owns some of them, but somehow they convinced there's a few spots that Home of Peace owns themselves, which was good for Kohanim, and he gave it to us. About 1:45, Frankie calls me up. We have a big problem. Well, a little before that, I heard that I have to get a good Tahara team. Can't rely on their own in-house team to do a karoi. Called Rabbi Lopian, my Rebbe. Right away he was driving, he says, "I'll ask Rabbi Gottesman." Rabbi Gottesman called me up. I was in his kavod, I should have called him up. But he called me up right away. He says, "I have connection with Chevra Kadisha." I was anxious. I said, "Forget about them. I already have Home of Peace." He says, "Okay." I said, "I just need a tahara." He says, "Call Bruce Bloom, Baruch Bloom." Standing next to me was Usher Peretz, and he also is a helper in the tahara team. He's like, "I know the Chevra." He called Mr. Longer, called Baruch Bloom. Happens to be that Baruch Bloom was in his own chemotherapy, and he came out of it just to come for the Tahara. They came for the Tahara. They got there a little bit earlier than us, 2:30. So about 1:45, I got a call from Frankie. He says, "We have a big problem." I called transport. He says, "We're not allowed to pick him up from the 5th floor. We have to pick him up from downstairs." And the transport says they give priority to people that are alive, and it's going to take an hour and a half to get him downstairs. This is 1:45. We told people 3 o'clock. I went to the nurse and the social worker, Marla, and I told them I need him down in 5 minutes. The driver's getting there. If you can't do it, I'll call my VIP line. I'm going to call Joanna or Tiffany during the day. So I'm going to call them. They were truly shocked how it was all working out, how we got the coroner's office, guess they took a step back and they said, he's going to be down in 5 minutes. You don't have to call anybody. They saw that the Yad Hashem was just working magic. And he was down in 5 minutes. They had to wait a few minutes till they get paperwork from the other building, and then he was on his way by 2:03. He got to somehow we left a few minutes later. We got there before him, but he came in about 3:31. Yehuda showed up to the Home of Peace. They did the Tahara. They did it slowly. They did it karaui. They said a tefillah after each aver, after each body part. They took their time. Some of the stories that people might have heard, how they were so makbid on tefillin to put it on karaui, to even put on a second set of tefillin. Even though you only achiv to put it on one hand, he wrote with his left hand, but did other stuff with his right hand, but he was machmir. He was extremely careful about his tefillin. He always encouraged others to put on tefillin. We checked his tefillin. They looked brand new. They were shiny. They were put away just like a bar mitzvah kid would put it away the first time, exactly how we got it. If there was ever a spot on it, he would sit down for hours to make sure that he would color it again. He came 10 minutes late to breakfast every day. Put away his tefillin karaui. He cared about it. He showed his friends how to put it on karaui properly. It really meant a lot to him. Rabbi Zadmir, that was saying the tefillot in the Tahara room, told us when he told them to wash the hands, he said he saw his left hand. Yehuda picked up his left hand to give it to them. Asher Peretz, that was washing the hands, told us that the norm for the hand is to clench up the muscles. I'm not sure exactly why, but Yehuda's muscles didn't clench up, and he washed it with a breeze. Who knows? Maybe that was his zechut of his carefulness with tefillin. And it came out about 4:30. They buried him by 5. Rav Steinman in his tzava, in his will, wrote that he wants to be buried within 6 hours. His name was Aryeh Yehuda Leib. Aryeh Yehuda Leib. Our Yehuda also was buried within 6 hours. Here in California, unheard of, on a Friday. There's a few hundred people by the Levaya. Everyone was in tears. We're not allowed to be maspid him. I'll say a few words, 2 minutes. And everyone made it home in time for Shabbos. There was no chila Shabbos. We got back here, everything was set up somehow. Within a few minutes, everything was set up. The whole episode went from Sunday to Friday. The whole Friday morning, I was asking my father, Shabbos elevator. I couldn't use a stairwell. You need a key, a card to get into the 5th floor. Yehuda didn't want any of the shilas. He went before them. Some of the stories came out. He was such a giving person and not a taker. He would always give rides, teach people how to play ping pong, help anybody out, watch out for the kid that was left out. Part of the sequence of events will show us this also, how he didn't want anybody to matriach him in the hospital. He didn't want anybody to know he was sick. He would get upset if somebody found out. Don't daven for me. I'm fine. Don't go out of your way. Don't visit me. He invited a few friends only. Let them come just to chill. He was fine. He acted like he was fine, like nothing was wrong. Just one story on this Nakuda was his 8th grade Rebbe came 2 nights ago and told us that whenever he would take the class out, when they got ready for an award, he would take them to pizza or something as a gift to the class. Yehuda would come and pay for his pizza. He would give money to his Rebbe. His Rebbe was like, I got it for everyone. What do you mean? He couldn't take. He couldn't take from anybody. He can only give. If you look at the sequence of events, Friday, besides it's a Siman Tov, it rained on Friday, there's no Chibur HaKever, there's no Din. It's the last time possible to be niftar, that the Shloshim will end by Shavuos. It means we get up on Thursday morning and Friday morning we can get a haircut because the Shloshim are Shavuos. There's no Chiyuv Kaddish after that. For a son or a brother, after Shloshim there's no Chiyuv. He wouldn't want us to be matriach. He wouldn't want us to bother ourselves to say Kaddish for him. He didn't want anybody to do anything for him. My father has a minhag to not shave, not get a haircut even, until Erev Shavuos. It wasn't even bothering us not to shave. That's when we would do it anyways. It happened on a Friday. By the time we got back, it was Shabbos. It's usher to cry. Usher to show Avelus on Shabbos. By the time you're allowed to cry on Motzei Shabbat, as much pain as there is, it's not as strong as right afterwards. He didn't want us to cry for him. He didn't want to bother us. We weren't able to be maspid him. We weren't able to say a hesped on Friday because of Shabbat. We were thinking about doing something for Shloshim, but there's no Shloshim. It's Friday. So we said, let's do something for the Shiva. It's usher to do hesped between Rosh Chodesh, Sivan, and Shavuot. And I'll do hesped. That was his minda. He didn't want to bother us. The whole Yad Hashem, from beginning to end, was painless. He went when he was sleepy. He went b'shalom. There's one other story which I just think it's so powerful. I'll end with this. We ran a pledge campaign, a crowdfunding campaign right after Purim. So we posted, the last video we had was from our banquet, about 6, 7, 8 months prior to that. And one of the programs that we spoke about in the video was Monday Night Sushi. We stopped the program because the elementary boys went to Yeshiva, went to Calabasas, and they had night Seder. So he calls me up and he told me, your video is misleading. It talks about Monday Night Sushi, and you don't have it. I told him people know around here. People that are not around here don't know. He was upset. I told them that people understand that if you put your last video, not necessarily is everything up to date, you wouldn't hear of it. And I pressed him further. Maybe it's not so much the program, it's the people that are behind the program. If they can do a Monday Night Sushi, they can do another program. He got very frustrated with me. And he screamed at me. Doesn't scream at me usually. And he said, "You're a liar and a cheater." It wasn't 100%. It was 99%. It wasn't 100%. I'm a liar and a cheater. I didn't leave it at that. He called me at least 5 times. You didn't take it down yet. You didn't put a disclaimer. It bothered him to his core. And when he saw that wasn't working, he came to the office, screamed at me, screamed at Rabbi Gigi, and he said, "You guys are liars." Ad kedei kach. He had a midah of emet, straightforward. It bothered him if somebody wasn't straight. He was a gem. He was the community's gem. We didn't see it. We didn't realize it until we lost the gem. If everyone could take his message to fill in, giving, emet, B'ilel nishmato, and maybe a Melet Yosher may protect us from upstairs. Amen.